If we are to look closely at the spine, you will see that the vertebrae are of different sizes. The size and structure of the vertebrae give us a clue to their function. The cervical vertebrae are small and have less bony structures around them so as to enable more movement or mobility, for example head rotation or flexion extension, whereas the lumbar vertebrae are large and have a lot of bony structures. They need to be large in order to withstand the weight of the body and all the compression forces that pass through here. Just note that any time an area has more mobility, then the stability of the area is compromised. This is a concept that we will continue to explore throughout this course. So the cervical region has mobility at the expense of stability. The lumbar region has more stability, but not anywhere near as much mobility. The thoracic vertebrae change in size, getting larger as they descend towards the lumbar region, giving this section a combination of both mobility and stability. You can also recognize them because this is where the ribs attach. As you can see, 12 pairs of ribs equal 12 thoracic vertebrae. Whilst the vertebrae are different in size, they do have similar bony landmarks. This part here is called the body of the vertebrae, and these are the central building blocks of the vertebral column. These bony bits are called the spinous processes. You can feel these quite easily on yourself. Place your fingers into the groove of your back and feel for the bony bits. See how far up or down your back you can feel them. These are your spinous processes. Now keep your fingers on the processes and flex forward, and then extend backwards. As you flex forward, you should feel the distance between the spinous processes get bigger, and then as you extend backwards, the processes come closer together. Between each vertebrae is a tough but malleable disc called the intervertebral disc. Inter meaning between, so between the disc. These allow for movement at each intervertebral joint, help prevent degeneration of the joining vertebrae, and help absorb compression. Each disc has a tough outer rim and a pulpous center. Think of it like a tough donut with a gooey center. Now, you may have heard the term having a slipped disc. Despite popular thoughts, a disc cannot slip out. It is firmly attached to the vertebra, but what can happen is that a disc can get damaged, inflamed, or even herniated. Disc damage can occur when there is a repetitive force placed on them in an unbalanced way, such as when one has poor posture, which leads to wear and tear, and in some extreme cases, damage that requires serious medical attention. As we move or change positions such as standing, sitting, or bending over, pressure changes in the disc occur, with some positions creating more pressure on the discs than others. For example, there is little pressure on your discs when you are lying down on your back. However, when sitting in a slouched position, the pressure on the discs are really high. Even though the discs are designed to withstand all these pressure changes, it is important to be mindful of your posture, and in particular when exercising. Let's imagine what is happening to the discs when you change position. In your chair, sit up nice and tall, and imagine how your spine and discs look all stacked neatly in their optimal position, or in what we would call a neutral position. Now bend forward in your chair, and as you do so, think about which direction the jelly center of your donut-like discs are going to ooze towards. If you think they are going to ooze posteriorly or towards the spinous processes, you are correct. Return to a neutral position and now arch backwards or extend the spine. Which way does the jelly center ooze now? You should imagine it oozing anteriorly or towards the front.